Okay, so today I'm going to be talking to you guys about the prevention of opioid use disorder for patients, and the people in my group are Erin, Hadley, Mckenzie, Adams, myself, and Mathilda, Lail, and Meagan. Did you know that pain is a leading cause of disability globally? The dramatic increase in opioid prescriptions within the past decade in the United States has contributed to the opioid epidemic the country currently faces, magnifying the need for longer-term solutions to treat pain. And there are a couple pictures of the most common locations for pain. So, what is chronic pain? Chronic pain is a type of pain that typically lasts longer than 3 months, and patients with chronic pain have alterations in brain regions involved in cognitive and emotional modulation of pain. It is common for patients to report pain with no evidence of tissue damage, which provides evidence of several different dimensions of pain. These dimensions include sensory, emotional, and cognitive dimensions. With the sensory dimension, you're saying where does it hurt and how much does this hurt me, whereas the emotional dimension is how unpleasant is this experience for me, and the cognitive dimension is how do I interpret my pain based on previous experiences I may have had. So, the transition from acute to chronic pain can be influenced by life experiences or environmental triggers. A couple examples of these are traumas, abuse, or low educational environments, or social isolation. So, there are 3 pillars associated with pain, and that's the biological, social, and psychological. These 3 pillars together are referred to as the biopsychosocial approach, which is now incorporated in how we as physical therapists aim to treat and educate the patient about their pain. The biological pillar consists of the actual physical disturbances the patient may experience. This can be attributed to the body by being hypersensitive due to previous pain and working as a protective mechanism to keep further pain or harm from occurring. The next 2 pillars happen secondarily due to physical pain. The social pillar deals with the past traumatizing events which connect the person's pain to a specific event such as abuse exposure, work-related injuries, and pain with movement. The psychological pillar takes into account how pain can cause mental barriers that can transition to their daily life. This can cause issues such as the fear of moving, anxiety, and catastrophic pain beliefs, which can cause your pain to increase. And a lot of people go through this because they think that moving is going to cause more pain. So we're just trying to make you see that movement can actually help your pain. How can chronic pain lead to opioid use? So each year, millions of Americans experience chronic painful conditions, and many of them are prescribed opioids whenever they are experiencing this pain. So many of the patients never really intend to misuse the drugs, but the pain relief and other effects of opioids may lead to an over-reliance of the drugs. The over-reliance, in turn, leads to misuse and the opioid use disorder. So how can physical therapy help with your pain? Sources state that aerobic exercise reduces pain with fibromyalgia while also combining stretching and strengthening to reduce pain associated with chronic low back and neck pain. Physical therapy can lead to secondary exercise-induced changes such as improved psychological status and cognition, exercise-induced pain relief, functional instructional brain adaptations, and there's also guideline treatments for chronic low back pain, recommended exercise therapy programs, non-opioid medication, and psychosocial interventions. So, physical therapists are seen as frontline practitioners, even though most of the time they aren't recognized as that. So, physical therapists are in a unique position to address pain prior to a patient's exposure to medication. Seeking treatment from a physical therapist before seeking medication can reduce the use of opioid abuse. In the 2000s, according to Davenport, 75% of individuals illicitly using opioids started with prescription opioid use. This results in the use of illicit drugs such as heroin and other prescription medications like oxycodone, hydrocodone, and codeine. Assessing a licensed physical therapist to begin your journey to using movement as medicine can prevent potential dependency on opioids and decrease the estimated $600 billion per year spent on chronic pain in the United States. All we're asking you to do is to go out into your community, and if you feel any pain, go reach out to a physical therapist, because more often than not, we can help you with your pain before you're prescribed your drugs. And these are our references.